The blood hit the floor before anyone had time to react. A man with a piece of rebar through his left shoulder had stumbled through the ER doors at Crestwood Medical Center, and Dr. Adrian Cole, Ashford's most celebrated trauma surgeon, the man whose name appeared on 3 hospital wings, was pointing at a nurse instead of the patient. "Get her out of my trauma bay." 30 staff members watched. Nobody moved. "She corrected my dosage order in front of a patient." His voice dropped to something worse than a shout, something cold. "I don't care what your name is. You're done here." The nurse he was talking about was 29 years old, 5'4", with blood already on her gloves from the IV she'd placed before anyone else had touched the man dying on the table. She didn't argue. She didn't cry. She pulled off her gloves, dropped them in the biohazard bin, and walked out. What no one in that room knew, what she had never told a single person at this hospital, was that the last time someone had bled out in front of her, she'd been keeping him alive with one hand while returning fire with the other. If you're watching this story, hit like, follow my channel, and drop the name of the city you're watching from in the comments below. I want to know how far this story has traveled around the world. Lauren Hayes had been at Crestwood Medical Center for 11 weeks. She had not made friends, exactly. She had made allies in the way that quiet people do, through small acts that other people noticed without fully understanding. She remembered how the overnight phlebotomist took her coffee black with no sugar. She covered the last 20 minutes of a tech shift without being asked when the woman's daughter called from school with a fever. She learned the names of the housekeeping staff before she learned the names of the attending physicians, which said something about her priorities that she wasn't particularly interested in explaining to anyone. The nursing staff on the 3rd floor of Crestwood's trauma wing had mostly decided she was fine. Competent, quiet, a little odd. She didn't go to the after-shift drinks at Callahan's bar 2 blocks east. She didn't talk much about herself. When someone asked where she'd worked before, she said, "A few different places," and changed the subject with a smoothness that made people forget they'd asked. What she was, at Crestwood, was a floor nurse, not a charge nurse, not a specialist. She handled intake, post-op monitoring, IV management, and the 1,000 invisible tasks that kept a trauma floor from collapsing under its own weight. She did her job. She did it well. Nobody was particularly paying attention to how well. Dr. Adrian Cole had been at Crestwood for 14 years. His name was on the Cole-Ashford Trauma Protocol, a set of emergency procedures the hospital had adopted in 2019 and used as a selling point in its annual report. He had a corner office on the 4th floor with a view of the river. He had performed over 2,000 major surgeries. He had a reputation for results and a separate reputation, spoken more quietly, in break rooms and parking garages, for being the kind of man who got results by making sure everyone around him understood the cost of failure. He was, by any measurable standard, an excellent surgeon. He was also the kind of man who heard a nurse say, "Doctor, Cole, the chart shows 40 milligrams, but the standard protocol for his weight and renal function is closer to 25, and experienced it not as information, but as an attack. The patient's name was Gerald Marsh. 61 years old, brought in after a workplace fall with suspected internal bleeding and a blood pressure reading that had the intake team moving fast. He was conscious when he arrived, barely, and scared in the way men his age got scared when they'd been ignoring their bodies for too long and suddenly couldn't anymore. Lauren had been the nurse on rotation when he came through. She'd gotten his line in, pulled his chart, noted the medications he was already taking, specifically a diuretic and a blood pressure medication that, combined with the dosage Cole had just ordered, created a real and specific risk. She had said so, quietly, without theater, in the kind of voice that was designed to communicate information rather than win an argument. Cole had looked at her for a long moment. "Who are you?" "Lauren Hayes. I'm the floor nurse on—" "I know what floor nurses do." He had turned back to the patient. "The order stands." "I understand, but the chart shows he's on hydrochlorothiazide, and with the renal, the order stands." There were 6 other people in the trauma bay. A resident named Marcus Webb, 2 other nurses, a tech, and a paramedic who was technically supposed to have left already. Every one of them had stopped moving. Lauren had looked at the chart again. Then she had looked at Gerald Marsh, who was watching the ceiling with the focused expression of a man trying very hard not to think about what was happening to him. She had picked up the medication chart and made a notation. Cole had seen her do it. Put that down. I'm documenting my concern for the record. I said put it down. He had crossed the room in 4 steps. I've been practicing trauma surgery since before you finished high school. You do not walk into my trauma bay and second-guess my orders in front of my patient. I understand. Do you? His voice had dropped. Because what I'm seeing is a floor nurse. A floor nurse, not a resident, not a specialist, a floor nurse, deciding that her 11 weeks of experience at this hospital outweigh my clinical judgment. I'm not questioning your experience. Her voice had stayed level. I'm flagging a potential interaction based on his current medications. Get out. She had gone still. I want you out of this trauma bay, right now, and I want someone from HR in my office in the morning, because this, he had gestured at her, at the chart, at the whole situation, is not how this hospital functions. She had left. Marcus Webb had caught her in the hallway, his face doing something complicated. He was 26, still in his first year of residency, and he had the look of someone who was adding up costs in real time. For what it's worth, he said, you were right about the dosage. I know. He's going to go after you. I know that too. She had walked to the break room, made herself a cup of terrible coffee from the machine near the window, and sat down with her phone. Not to scroll, not to text anyone, just to sit, just to be somewhere quiet for 4 minutes before going back to work. She had been in louder rooms than that hallway. She had been in much louder rooms. Cole went after her the way men like him always did, bureaucratically, incrementally, with the patience of someone who had learned that the most effective kind of punishment was the kind that looked like procedure. He submitted a formal complaint to nursing administration citing insubordination and interference with clinical decision-making. He rerouted several of his cases away from her floor and made sure the charge nurses knew he preferred not to have Lauren Hayes in his orbit. He made comments, never directly to her face, but always in spaces where they would be repeated, about nurses who didn't understand their role in the chain of command. None of it landed the way he intended. Not because the administration didn't take him seriously. They took him very seriously, the way institutions always took their most decorated people seriously. But because Lauren was good at her job in ways that were difficult to dismiss even when people wanted to. She caught a post-op patient's internal bleed 2 hours before the monitoring equipment flagged it, because she had noticed the patient was holding his breath in a specific way when he shifted position. She identified a sepsis case in a woman who had been coded as a routine recovery patient, because the woman's skin had a color Lauren had learned to associate with things going wrong in a very particular direction. She managed a respiratory crisis on her floor with the kind of efficiency that made the resident who'd been first on scene feel afterward like he'd been watching someone who had done this particular thing many more times than 11 weeks could account for. People noticed. They didn't say much about it, but they noticed. Dr. Cole noticed too, which made things worse. He started assigning her to the administrative tasks that nobody wanted: inventory audits, supply chain documentation, the kind of work that kept a competent nurse away from patients and behind a computer. He contested 2 of her chart notations in formal review, both times unsuccessfully, but the reviews themselves were time-consuming and unpleasant. He scheduled her for a run of overnight shifts without rotating break, which was technically within the limits of hospital policy and practically miserable. She worked the overnight shifts. She did the inventory audits. She filed her responses to the chart reviews with the same careful documentation she brought to everything else. She did not complain to anyone. She did not ask for help. She did not, as several of her colleagues quietly hoped she might, quit. What she did was learn the hospital. 11 weeks became 3 months. She mapped Crestwood's rhythms the way she had mapped other environments, not consciously, not with any particular plan, but with the attentive, automatic awareness of someone whose body had learned that knowing your terrain was not optional. She knew which supply closets had the best stock rotation, which elevators ran slow on Tuesday afternoons when maintenance did their checks, which nurses on the overnight rotation were running on 3 hours of sleep and needed someone to cover their hard tasks without being asked. She learned the hospital the way she had learned other things, by paying attention until it became instinct. What she did not do was talk about the other places she had learned things this way. The call came at 6:47 on a Thursday morning in late October. Lauren was 40 minutes from the end of a 12-hour overnight when the first scanner alert lit up the charge desk. She heard the words chemical plant and explosion and multiple casualties en route in that specific order, and something in her went very still. Not afraid. Still. There was a difference she had learned to recognize. The Harwick Processing Facility was 11 miles east of Ashford, a natural gas and chemical refinery that had been operating since 1987. The explosion, she would learn later that it had been 3 sequential blasts, each triggering the next, had occurred in a storage section that held industrial solvents and pressurized compounds. The initial blast radius had been significant. The secondary fires had been worse. The first ambulance arrived at 7:03. By 7:15, there were 9. Crestwood's ER had a surge capacity of 42 patients. By 7:30, there were 51 people either inside the building or in the ambulance bay, with more incoming. The triage area had become a corridor, then a waiting room, then something that didn't have a clinical name, just bodies and noise and the specific kind of chaos that happens when a system hits a load it was never designed to carry. Dr. Cole had been called in from home. He arrived at 7:22 in a pressed shirt that looked wrong against the blood already on the floor. And Lauren watched him walk into the ER bay and stop. She had seen that stop before. Not in a hospital. Elsewhere. It was the stop of someone whose training had given them a script and who had just realized the situation didn't match the script. He started giving orders. They were the right orders for a normal surge. Reroute non-critical intake. Call in off-shift staff. Contact the regional trauma network for overflow capacity. They were organized and clinical, and they were about 45 seconds behind where the situation already was. Marcus Webb was moving between patients with the focused energy of someone running entirely on adrenaline and refusing to think about what would happen when it ran out. 2 ER nurses were managing IV lines on patients who were lying on gurneys in the hallway because there were no rooms. A paramedic named Ortega was on his 3rd trip back from the ambulance bay with another gurney, his jacket soaked through with someone else's blood. Lauren was standing in the center of the triage area. She was counting. Not patients exactly. She was counting variables. The number of airways she could see that were compromised. The proportion of burn injuries versus blast trauma versus crush injuries. The rate of incoming versus the rate at which people were being stabilized and moved. The personnel available against the tasks that needed doing in the next 15 minutes versus the tasks that could wait. She had done this math before, not with these numbers, but with this math. Cole's voice cut through the noise. I need the overflow rooms opened on 3 and 4, and I need someone to get on the phone with regional right now. That's going to take 40 minutes minimum, Lauren said. Cole turned. She was already moving, pulling a whiteboard from beside the nurse's station on wheels, uncapping a marker. We don't have 40 minutes. We need to switch protocols. Excuse me? Military mass casualty triage, modified for a civilian ER. She was writing on the board as she talked, not looking at him. We sort by survivability and resource cost, not severity. We identify our critical but stable cases and hold them. We concentrate resources on the cases that will die in the next 10 minutes without intervention. This is not a battlefield. No. She turned then and looked at him directly. But the math is the same. The room had gone, not quiet. It couldn't go quiet. There was too much happening. But a particular kind of attention had shifted. People were looking at her. Cole's face did something she recognized. The specific calculation of a man deciding whether his authority was more important than the situation in front of him. It took him 4 seconds. He said nothing. Lauren turned back to the board. Webb. Her voice was not loud. It carried anyway. You're on airways. Anyone with respiratory compromise gets flagged red and you don't leave them until they're stable or someone takes over. Go. Webb went. Ortega. The paramedic looked up from the gurney he was unloading. Stop bringing in the ambulatory patients. Anyone who can walk gets triaged outside. Nurse Tran. She had located Tran across the room. Take 2 people outside and do entry assessment. Anyone who can wait, waits. Tran was already moving. She grabbed 2 nurses without asking their names. The burn case is on the east wall. Lauren had crossed the room, marker still in hand. 3rd-degree coverage on more than 40% is a different protocol. Who's our burn specialist on call? Dr. Whitmore, someone said. She's coming in from home. ETA? 20 minutes. Then for the next 20 minutes, those patients get fluids, airway management, and nothing else. Don't debride, don't dress the major wounds, don't... She stopped beside a patient, a man in his 40s with burns across his left arm and chest, and looked at him briefly. His breathing was labored but rhythmic. His eyes tracked her. What's your name? Patterson, he said. Ray Patterson. Ray, you're going to be okay. I need you to keep breathing just like you are. In through the nose, out slow. Can you do that? Yeah. His voice was hoarse. Yeah, I can do that. Good. She straightened. Don't let anyone move him until Whitmore gets here. She had been operating for 11 minutes. She was on her second circuit of the triage area when she heard the voice. Hayes. She didn't stop moving. Little busy. Lauren Hayes. She stopped. The man was on a gurney against the east wall, his left leg splinted and his face marked with the kind of grime that came from being near an industrial explosion rather than inside one. He'd been at the perimeter, she assessed automatically. Secondary blast effects, probably the parking lot or an adjacent structure. He was in his early 50s, lean, with close-cropped gray hair, and the specific way of lying still that people learned when they had spent time in environments where stillness was a survival skill. She didn't recognize him. Then she did. Reeves, she said. Thought that was you. Sergeant First Class Daniel Reeves, retired, formerly of the 75th Ranger Regiment, now apparently a contractor at the Harwick facility. He was looking at her with an expression that mixed pain and recognition and something else. How long have you been here? 3 months? As a nurse. As a nurse, she confirmed. He looked around the organized chaos of the triage area. At the board she'd set up, at the personnel moving in the patterns she'd established, at the specific structure she'd imposed on something that had been, 11 minutes ago, close to collapse. You run a mass casualty exercise recently? No. He was quiet for a moment. Still Lieutenant Hayes then, even in scrubs. Let me see your leg. She crouched beside the gurney, checking the splint, assessing the circulation below the injury. The splint was properly done, Ortega's work probably. This is a good field dressing. Where'd you... Did it myself. A pause. I've had good teachers. The room was still moving around them. She was still tracking all of it, the monitors, the voices, the rate at which situations were developing. But something had happened in the quality of the air. A few people nearby had gone quiet in a different way. You were Army? One of the nurses asked. Lauren didn't look up to see who. She wasn't just Army, Reeves said. She was... Reeves. Her voice was quiet. Your circulation is fine, the break is clean, and you're going to be okay. I need you to be patient for another 30 minutes while I make sure the people in worse shape than you get sorted. Of course. He settled back. Then to the room. 14 months in Kandahar province, 3 in Syria. She kept a team of 12 alive through a situation I'm not going to describe in detail, because some of you look like you haven't had breakfast yet. Lauren had already stood up and was moving toward a respiratory alarm 3 gurneys down. But she could feel it. The shift in the room, the weight of eyes that were suddenly seeing her differently. Cole, somewhere behind her, had gone very quiet. The problem with being looked at wasn't that she couldn't handle it. The problem was what tended to follow. She got to the patient with the respiratory alarm. A woman, mid-30s, blast lung, the injury she'd been watching for since the first ambulances arrived. And she had about 45 seconds to get the situation stable before the window closed. She did not think about Reeves's voice. She did not think about the way Cole had gone quiet. She did not think about Kandahar or Syria or the 11 months of her life she had spent in places that she had systematically declined to discuss with anyone at Crestwood Medical Center. She thought about the woman in front of her, whose name she didn't know yet, whose airway was closing in a specific and manageable way. She thought about what the next 45 seconds required. Outside the hospital, 3 more ambulances were pulling into the bay. And on the highway coming into Ashford from the east, moving fast in a convoy that the state police had already cleared the route for, a line of military vehicles carried people who had been monitoring the situation at Harwick since the first explosion. People who had a particular interest in the personnel at the blast site, in the coordination of the emergency response, and in one specific set of personnel records that, until this morning, had been filed under a classification level that the nursing staff of Crestwood Medical Center had no reason to know existed. The woman with blast lungs stabilized. Lauren Hayes moved on to the next patient. The convoy was 12 minutes out. The convoy was 12 minutes out. Lauren didn't know that. She knew the woman in front of her, 40s, dark hair matted with grime and blood from a scalp laceration that had bled aggressively and looked worse than it was, had oxygen saturation at 84 and dropping, which meant the next decision had about a 30-second shelf life. "I need a needle," she said. Not loud. Loud enough. A tech named Bowers materialized at her left with a 14 gauge, which was either luck or the result of Bowers paying attention to what she'd been doing for the last 20 minutes. She didn't ask which. Tension pneumothorax. The blast had pushed air into the pleural space on the left side, and the lung was collapsing against the pressure. The fix was fast and brutal, and not something a floor nurse was supposed to do unassisted, without a physician present, in the middle of a hallway. Lauren did it anyway. The needle went in at the second intercostal space, mid-clavicular line. There was an audible release, a small hiss of pressure equalizing, and the monitor's alarm changed pitch. Not gone, but different, moving in the right direction. The woman's eyes opened. "You're okay," Lauren said. "Breathe slow. Let your body catch up." The woman's hand found Lauren's wrist and gripped it. She didn't say anything. She didn't need to. Lauren held still for exactly 4 seconds, long enough for the grip to mean something, then extracted her hand and moved. Behind her she heard Cole's voice, not directed at her, directed at Webb, asking something about the chest decompression she'd just performed. Webb's answer was too quiet to catch. Cole's silence afterward was not. The board she'd set up was working, not perfectly. Nothing about this was working perfectly. A supply cart had been knocked over near Bay 4, and nobody had time to fully clear it, so the floor was a hazard. One of the nurses Tran had assigned to outside triage had come back in because 2 patients had deteriorated faster than expected, and the outside station had become unmanageable. The overhead PA kept cycling through the same mass casualty announcement on a loop, and the repetition was doing something unpleasant to everyone's nerves. But people were moving. Decisions were being made and executed in the right order. The patients who needed immediate intervention were getting it, and the ones who needed to wait were waiting in a way that at least had some logic to it. That was the difference between chaos and managed crisis. Not that everything went right, that there was a structure for handling what went wrong. Lauren was on her 4th circuit of the floor when Marcus Webb fell into step beside her. "Cole filed something with the nursing director," he said. "While you were—" he gestured vaguely at the triage area. "While all of this was happening, I don't know what, but I saw him on the phone." She kept walking. "When?" "About 20 minutes ago, before things got this bad." A pause. "He called Dr. Harmon, too, chief of medicine." "Okay." "Lauren." Webb stopped, and she stopped because she recognized his tone, the tone of someone who needed to be heard rather than directed. "He's going to make this about you overstepping, about the needle decompression, about the triage reorganization. He's going to frame it as a floor nurse seizing authority during a crisis because she couldn't follow the chain of command." "I know." "And you're not worried about that?" She looked at him. Webb was a good resident. He worked hard, he cared, he had good instincts underneath the layer of training that kept telling him to defer. He was also, she noticed, slightly in shock. Not clinical shock. The human kind that happened when the morning you'd expected turned into the morning currently happening. "Right now I'm worried about the man in Bay 6, whose blood pressure has been dropping for the last 8 minutes, she said. "After that, I'm going to be worried about the 3 patients we haven't been able to fully assess because we're understaffed. Cole can do whatever he needs to do." Webb stared at her. "How are you this calm?" "I'm not." She was already moving. "I'm just busy." Bay 6 was a man named Torres. She'd gotten his name from the paramedic intake card someone had clipped to his gurney, who was 63 years old and had been at the refinery as a plant supervisor. His injuries were internal, which was the worst kind at a scene like this because they were invisible until they weren't. He'd been triaged as serious but stable based on his presentation at arrival, and for the first 20 minutes, that assessment had been right. It wasn't right anymore. Torres. She put a hand on his forearm. His skin was cool, which wasn't good, and his breathing had a quality she disliked. I'm Lauren. Can you hear me? Yeah. His voice was thin. Does your belly hurt? A pause that told her everything before he answered. Some. She pressed gently on his abdomen. He flinched, which was also telling. His pressure on the monitor read 88 over 54, and it had been 102 over 18 minutes ago. Internal bleeding. The blast had done something to his abdominal cavity that hadn't been visible at intake, and the body's compensation mechanisms were running out of road. She needed a surgeon. She looked up, and Cole was standing at the entrance to Bay 6, watching her. For a moment, neither of them said anything. Then Cole walked in, looked at the monitor, looked at Torres, and looked at Lauren's hand position. He didn't ask her what she'd found. He pulled on gloves and did his own assessment, and she watched him process the same information she had and arrive at the same conclusion. He needs an OR, Cole said. Yes. OR2 is running. OR3 is available. He straightened. I'll take him. She stepped back, and there was no triumph in it. Torres needed a surgeon, Cole was a surgeon, and the logic of that was clean regardless of everything else that existed between them. This was the part that people who'd never worked in emergency medicine didn't understand, that the personal collapsed under the weight of the immediate, and you could hate someone and still do the work correctly because the work was not about you. His pressure is dropping fast, she said. You have a narrow window. I know that. Does he? He held her gaze for a moment. Something in his face had shifted from what it had been 2 hours ago, or 3 hours, she'd lost track, when he'd walked in from home and found the triage board and the reorganized floor. He hadn't confronted her about it directly. She didn't know what that meant and didn't have bandwidth to figure it out. Go, she said. He went. She was still watching the gurney move toward the elevator when Reeves's voice found her from across the room. Hayes. She crossed to his gurney. He'd been moved to a more stable position against the south wall, his leg elevated, fluids running. He looked better than he had 40 minutes ago, which wasn't saying much. You should know, he said, that the convoy that's coming, it's not standard. She looked at him. I was at Harwick on contract. Security assessment, facility evaluation. There's classified material at that site. He paused. The people coming aren't just emergency management. How many casualties on site? When I left, there were 11 confirmed dead, maybe more. His jaw tightened. The cause wasn't an accident. She was quiet for 3 seconds. You know that for a fact? I know what I saw before the second blast. He shifted and pain crossed his face and then was gone. There was a timing sequence. The first explosion was localized, not the kind you get from equipment failure, the kind you get when someone knows where to put something. The ER noise around them continued. Monitors, voices, movement. The PA had finally stopped its loop. That's going to be someone else's problem, Lauren said. Your job right now is to not move that leg. I've had about 800 broken bones in my career, not literally, but close. Then you know how this works. She checked his fluids, noted his color, assessed his pain response with the practiced efficiency she'd never quite managed to make look casual. You're good for now. Don't make me come back here for a preventable reason. Wouldn't dream of it, Lieutenant. Don't call me that. His expression said he would call her whatever he wanted, but he let it go. She was 3 steps away when the ER entrance doors opened and a woman in a charcoal blazer came through. Not medical staff, not emergency personnel, not a patient. Hospital administration. Lauren recognized her from the all-staff meeting she'd attended in her first week. Diane Harmon, Chief of Medicine, 61 years old, with the expression of someone who had walked into a situation she had been told about and who was now recalibrating based on what she was actually seeing. Harmon stopped just inside the doors and looked at the floor, then at the board, then at the patient flow, then, after a long moment, at Lauren. Their eyes met across the length of the ER. Lauren turned away first. There was a pediatric case near Bay 2 that had been flagged and she hadn't gotten to it yet, which was the thing she was least comfortable with of everything happening this morning. A child, 8 years old from the intake card, brought in with a parent, the parent critical, the child's injuries unclear. She went to Bay 2. The girl's name was Maya. She was sitting upright on the gurney with her knees drawn to her chest, which was a position Lauren recognized as a child's attempt to make herself small enough that the situation would stop being real. She had a laceration on her right forearm, cleaned and bandaged by someone. Good work, probably Tran or one of the nurses from outside triage. She was not, as far as Lauren could assess, critically injured. She was alone. "Hey!" Lauren sat on the edge of the gurney, not standing over her. Eye level mattered with kids. "I'm Lauren. What's your name?" "Maya." "Does anything hurt besides your arm?" Maya shook her head. Her eyes were dry, which wasn't necessarily good. Sometimes kids went past crying into something quieter that was harder to read. "Do you know where your dad is?" A beat. "It was my dad who—" She stopped. "It's okay. You don't have to explain right now." Lauren did a quick visual assessment. No chest asymmetry, no favoring of any limb, pupils equal and reactive when she checked with a small light. Physically, the girl was okay. "Do you have another family member we can call? A mom? Or a grandparent?" "My grandma, she's in Ashford." "What's her name?" "Sandra Kowalski." Maya said it very carefully, like she'd been taught to say it in exactly this way for exactly this kind of situation. "Her number is in my dad's phone, but I know it. I have it memorized." "Good. That's really good." Lauren looked around, caught the eye of a nurse named Galvez who was passing. "Get me a phone for this patient and someone to stay with her. She has family to call." Galvez nodded and moved. Lauren looked back at Maya. The girl was watching her with an expression that was hard to categorize. Not fearful, exactly. Assessing. The kind of look that children gave adults when they were trying to determine whether the adult was actually in control or just performing control. "Are you a doctor?" Maya asked. "No, I'm a nurse." "My dad said nurses do most of the real work." "Your dad sounds pretty smart." "He works at the plant." A long pause. "He was working today." Lauren held very still. "What's his name?" "David Kowalski. He's a maintenance tech." Another pause. "Is he here?" She didn't know. She genuinely didn't know. And there were 50-plus patients in this building and more in the ambulance bay, and she hadn't memorized every intake card. She could have said something comforting and vague. She didn't. "I don't know yet," she said. "But I'm going to find out, and someone is going to stay with you right here until we have an answer or your grandma gets here, okay?" Maya nodded. Once. Precise. Galvez came back with a hospital phone and a nursing assistant named Portman, who had, in Lauren's 3 months at Crestwood, demonstrated a reliable capacity for calm in situations that made other people agitated. She left Maya in Portman's care, took the intake manifest from the nurse's station, and scanned it for Kowalski. He was there. Bay 7. Status? Critical, pending surgical consult. Cole was already in an OR with Torres. She found Webb. "Bay 7, she said. "Kowalski. I need a surgical consult and I need it before his pressure drops. Who do we have?" Webb was already on it, pulling up the on-call schedule. "Dr. Vasquez is in. She finished a case at 6 this morning. She should be available." "Get her." He got her. That was the rhythm of it. Not smooth, not clean, ragged and sequential and driven by the logic of immediate need. Vasquez was a vascular surgeon, not a trauma specialist, but trauma specialists were scarce right now and Vasquez was here and competent. Lauren gave her the rundown on Kowalski in 90 seconds flat. Mechanism of injury, vitals trend, her assessment of the likely injury pattern, and Vasquez listened the way surgeons listened when they trusted the information they were receiving, which was differently than they listened when they didn't. "You assess this yourself?" Vasquez said. "Initial triage, yes." "Good call." She was already moving toward Bay 7. "Let's see him." The ER was beginning to thin. Not empty. It would not be empty for hours, possibly days, but the initial surge was past its peak and the protocols were holding. Patients were moving through the system. The ambulance arrivals had slowed as the most acute cases from the blast site were exhausted and the remaining victims were being distributed to regional hospitals. It was 9:14 in the morning. Lauren had been on shift for nearly 14 hours. She was standing at the nurse's station updating the board when she became aware that the ER had changed in texture again. Not louder, not more chaotic, but different in some way she felt before she could identify it. People were looking toward the main entrance. She looked too. There were 4 of them. 3 men and a woman, in military service dress, moving through the hospital entrance with the particular economy of motion that came from years of institutional training, the kind of movement that expected space and got it. The one in front was a colonel, she could tell from the insignia. Tall, early 50s, iron gray hair, a scar along his left jaw that she recognized as the specific geometry of shrapnel. He was scanning the room the way she had scanned rooms, the way all of them did, whether they were deployed or stateside, because the habit did not turn off simply because you were in a hospital in Ohio instead of a forward operating base in the middle of nowhere. He saw the board. He saw the triage system. He stopped and read it the way someone read a document they were familiar with, following the logic of it, understanding what they were seeing. Then he looked at the room, at the movement, at the patients and staff. And then he looked at Lauren. She had known, from the moment Reeves had said the convoy wasn't standard, that this was coming. She had known from the moment she put up that board, and from the moment Reeves had said her name out loud in a room full of people who'd never heard it in that context, that the shape of things was changing. She had decided sometime in the last 4 hours that she was done being surprised by it. The colonel crossed the ER floor toward her. Behind him, his team spread out in the practiced way of people conducting an assessment rather than an arrival. The one on the left was already talking to Webb. The woman was heading toward the charge desk. He stopped 2 feet away. "Lieutenant Hayes," he said. His name was on his chest. She read it. She looked up. Colonel Briggs. Colonel Nathan Briggs had been her commanding officer for 11 months in a period of her life she did not discuss at Crestwood Medical Center. He looked essentially the same as he had the last time she'd seen him, 18 months ago at a debrief she was not going to think about right now, except that the scar was slightly more pronounced, and he looked like he hadn't slept in 2 days, which in her experience was his baseline whenever something was actively wrong. "You set this up," he said. Not a question. Looking at the board. It needed to be set up. "How long ago did they come in?" "First wave around 7. I've been running it since about 7:20. He was quiet for a moment, still reading the board. Modified mass-casualty protocols. Adapted for civilian ER constraints. Less personnel, different supply chain. How many critical? 16 in-house, 2 in surgery, 3 in the ambulance bay that I need to She stopped herself. "We've moved 41 through the system. 14 are in stable condition and holding in overflow. The burn unit is at capacity." Briggs looked at her with an expression she recognized as the one he used when something was confirming a thing he already suspected. He had a limited range of expressions. She had spent 11 months learning to read them. "We're here about Harwick," he said. "Reeves told me." Something shifted in his face. "Reeves is here?" "South wall, left leg fracture. He's stable." A pause. "He said it wasn't an accident." It wasn't. His voice dropped, not dramatically, but practically, becoming a frequency that was for her and not for the room. "We've been watching Harwick for 4 months. The facility was a front for a secondary operation. Not going to get into details in an ER, but you can fill in the gaps. The blast was intended to destroy documentation. Someone moved early, probably because they were spooked." She absorbed this. "How many people in the building knew?" "That's what we're here to find out." He glanced toward the entrance, where 2 more personnel had just come through. "We're going to need to interview staff and survivors. The facility's records are gone. We're working from survivor accounts." He paused. "And from the security assessment Reeves was contracted to conduct." "He had documentation?" "He's trained to maintain it in his head when physical records are compromised." Something that was almost a smile. "You'd know something about that." Before she could respond, the sound from the direction of the charge desk changed. She turned. Cole was there. He'd come back from surgery. She hadn't seen him come in, and he was standing at the charge desk looking at the board, at the modified triage system, at the status of his ER. And he was looking at Colonel Briggs. And he was saying something to Diane Harmon, who had been at the desk for the last 40 minutes conducting her own assessment, with an expression that Lauren could not read from this distance, but that she recognized in shape as the expression of a man making a case. Briggs followed her sightline. "Who's that?" "Head of trauma surgery." A pause. "He filed a complaint against me this morning, before the casualties arrived." "For what?" "Insubordination. Interference with clinical decisions." Briggs was quiet for a moment. "He filed a complaint against a floor nurse during a mass casualty event." "He filed it before the event." "But yes." Another moment of quiet. She could not tell what he was thinking, which was unusual. She had spent 11 months being able to read him. Then, what's his actual competency? It was a fair question asked in a specific way, the way military command asked questions when they were trying to build a picture fast. "He's a good surgeon," she said. "He froze when the surge came in. He self-corrected. He took Torres when he needed to go, and he did it right. Froze. 30 seconds, then he got back in." "Because of your board." She didn't answer that. Briggs looked at Cole for another moment. Then he looked back at her, and his expression had settled into something that was not quite calculation and not quite decision. Something in between. The expression of someone who had confirmed a thing they came here expecting to confirm. "I'm going to need you to stay," he said. "Not just as medical support. We need someone who understands both sides of what happened today, the medical response and the tactical situation." "I'm a hospital nurse." "You are right now." He said it without irony, without any particular weight. "Just, you are right now. How long until your floor is stable enough to leave?" She looked at the board, at the patient flow, at Webb, who was managing 2 cases simultaneously with the kind of focused competence that had grown over the course of the morning from adrenaline into something more sustainable. At Tran, who had reorganized the outside triage without being asked again and was now running it with a nurse she'd trained herself. 2 hours, she said. Maybe 90 minutes. We'll be in the conference room on 4. He paused. Bring Reeves if he can be moved. He turned and walked toward the elevator. His team pulled back toward him like a formation adjusting. Not staged, just the natural movement of people who operated together in environments where position mattered. Lauren turned back to the board. She made 3 notes, changed 2 status tags, and was on her way to check the woman whose tension pneumo she'd relieved. It needed reassessment, the initial fix was temporary, when she heard Cole's voice from behind her. Hayes. She stopped, turned. He was alone. Harmon had moved away toward the elevators, possibly following Briggs's team. Cole was standing in the middle of the ER floor with the particular posture of a man who was used to rooms reorganizing around him and was currently experiencing a room that had stopped doing that. Who was that? He said. Military liaison. He came here to see you. He came here because of the Harwick situation. A beat. He stopped to talk to me because he knows who I am. Cole's expression moved through something she didn't have a name for. Who are you? The ER continued around them. Monitors, voices, the click of gurneys. Someone down the hall was asking for a second IV line. The overhead lights were doing the thing they did in hospitals everywhere, the particular fluorescent hum that became the background noise of an entire professional life. Lauren Hayes, she said. Floor nurse, 3rd rotation. She walked away. She had 14 patients still in active management, a secondary pneumo to reassess, a little girl in Bay 2 waiting for news about her father, and a conference room on the 4th floor where she would be expected in 90 minutes to explain things she had not explained to anyone in 3 months. And Cole was still standing in the middle of the floor. And something had begun that she could feel in the specific way she felt things that had passed the point of being stopped. Not coming, not approaching. Already here. At the charge desk, she picked up the manifest and ran her finger down the list until she found David Kowalski. Status updated 3 minutes ago. Critical to serious. Vasquez had gotten to him in time. She would tell Maya. But first, she had to check the woman with the pneumo and adjust 2 fluid rates and make sure the overnight staff coming in at 10 had everything they needed to take over a floor that looked completely different than it had 14 hours ago when she'd started her shift. She moved. She worked. She did not let herself think about the 4th floor, or about Briggs's face when he'd said you are right now, or about the way Cole had looked standing in the middle of the room he'd run for 14 years. She thought about the work. She was good at that. She was on the far end of the floor, reassessing the pneumo patient, improving, the lung was re-expanding properly, oxygen saturation back to 94, a real number she could trust, when Portman appeared at her shoulder. "The little girl," Portman said. "She's asking for you. 5 minutes." She said, Portman hesitated. "She said she wants to ask you something, not about her dad, something else." Lauren taped the reassessment note to the patient's chart and handed it to the next nurse who could file it. "I'll go now." Maya was still on the gurney. Her grandmother had been reached, Portman confirmed this, and was en route. Her father was in recovery from a procedure that had gone well, which Lauren had made sure Portman told her as soon as the update came through. She was sitting in the same position, knees up, arms around her legs, but with a different quality to it. Less defensive, more just tired. "Hey," Lauren said, "your grandma's coming. Your dad's out of surgery and he's going to be okay." Maya let out a breath that sounded like it had been held for a long time. "Okay, then." "The man with the gray hair, the one in the uniform, he called you lieutenant." "He did. What does that mean?" Lauren sat on the edge of the gurney again. "It means I used to be in the army." Maya considered this. "And now you're a nurse." "And now I'm a nurse. Why'd you stop?" It was the question that several people at Crestwood had thought about asking and hadn't, because they could tell it was the kind of question that had an answer that would take longer than the answer suggested. This 8-year-old had asked it in 30 seconds. "It was time to do something different," Lauren said. "I wanted to help people in a different way." "Do you like it better?" She didn't answer immediately, which was itself a kind of answer. "Some parts," she said. Maya nodded as if this made complete sense. "My teacher says it's okay to have jobs that are hard." "Your teacher's right. She also says the hard parts are where you find out who you actually are." Maya said this with the confidence of someone who has recently received this information and found it to be useful. "I think that's true." Lauren looked at her. 8 years old, sitting alone in an ER on the worst morning of her life, quoting her teacher's philosophy with the composure of someone twice her age. "Yeah," Lauren said. "I think that's true too." She stayed another 2 minutes, then she went back to work. At 10:07, the day shift came on. Lauren briefed the charge nurse, a woman named Beckford, who had been doing this for 22 years, and absorbed the morning's events with the professional equanimity of someone who had learned not to be surprised, and handed off her active cases one by one. She was almost done when Beckford said, "There are people upstairs asking about you." "I know." Dr. Cole also left a folder with the nursing director's office. A pause, very precisely timed. "Apparently he's been building a case." "I know that too." Beckford looked at her for a long moment with the expression of someone who was recalibrating something they thought they understood. Then she said, "Whatever's in that folder, the nurses on this floor have 14 hours of this morning that say something different." Lauren looked at her. "We all do," Beckford said. "Just so you know." The elevator to the 4th floor was at the end of the hall. Lauren took it at 10:22. She was still in the same scrubs she'd started the shift in, which had dried blood from 3 different patients on the left sleeve and saline on the right. She had not eaten anything since a granola bar at 2 in the morning. Her feet hurt in a way she had stopped noticing around hour 6. The conference room was the second door on the left. Through the glass panel, she could see Briggs and 2 members of his team at the table, along with 2 people she didn't recognize in civilian clothes who had the specific bearing of federal agency personnel rather than military. There was a laptop open, documents spread across the table, and a recording set up in the corner. There was also Diane Harmon, sitting at the far end of the table, and there was someone else, a man she didn't recognize, in a suit with the particular look of a lawyer, not because of anything cliched, but because of the specific way he was holding a notepad and the way his eyes moved when she appeared at the glass. She pushed open the door. Every person in the room looked at her. Briggs stood. "Lieutenant Hayes?" "Still Lauren Hayes," she said, "but I'll take the room however it comes." She pulled out the nearest chair and sat down. And then the man with the notepad said, "Ms. Hayes, I represent the hospital board. And before we go any further, there are some serious questions about your conduct during this morning's crisis that need to be addressed." The room was very quiet. She looked at the man, then at Briggs, whose face had gone to the expression she knew as waiting. Not passive, not surprised, just waiting for her to decide how to handle this. Then she looked back at the lawyer. "All right," she said, let's talk." The lawyer's name was Garrett Foss, and he had the practiced patience of someone who billed by the hour and had learned that patience looked like power. He opened the notepad. "Ms. Hayes, the hospital board has asked me to document several incidents that occurred this morning during the Harwick response. Specifically," he glanced down, "the unauthorized performance of a needle thoracostomy, the unilateral restructuring of emergency triage protocols without physician authorization, and the direction of medical personnel in ways that fall outside the defined scope of a floor nurse's role at this institution." He said all of it in one breath. Not aggressive, procedural. The tone of a man who understood that the most effective pressure didn't come from volume. "Those are accurate descriptions of what happened," Lauren said. Foss paused. He hadn't expected agreement. Harmon, at the far end of the table, had gone very still. "You're not disputing the actions," Foss said. "No, I'm disputing the framing. There's a difference between unauthorized and necessary." She rested her hands on the table. The needle decompression was performed on a patient whose oxygen saturation was at 84 and dropping with a classic tension pneumo presentation. Waiting for physician authorization in that room, at that moment, would have cost her between 4 and 8 minutes. She had about 2. A beat. "She's breathing at 96% right now. You can check." Foss wrote something. "And the triage reorganization." The existing system was managing 22 patients. We had 51 in the building by 7:30. Dr. Cole's initial directives were correct for a standard surge and insufficient for what we were dealing with. She was not unkind about it, just accurate. "I implemented a modified mass casualty protocol because the situation required it. If someone with more institutional authority had done it first, I would have supported that instead." "But no one did." "No." Briggs had not said anything. He was sitting with his hands folded on the table, watching Foss the way Lauren had watched emergency situations. Not reactive, just tracking. Harmon spoke. "Ms. Hayes, the board's concern isn't primarily about this morning." Lauren looked at her. "Dr. Cole submitted documentation of a pattern of behavior going back to your first month here. Insubordination, interference with physician orders, circumvention of chain of command." Harmon's voice was careful, not hostile. "The events of this morning didn't create the concern. They accelerated it." "What documentation?" Harmon opened a folder. 3 formal written complaints, 2 chart review contests, a shift assignment record that Dr. Cole argues demonstrates your resistance to standard scheduling protocols. Lauren looked at the documents from across the table. She had known this folder existed since Webb had told her about it 4 hours ago in the middle of an active mass casualty event. She had not spent significant time thinking about it, which she now recognized might look to people in this room like either confidence or arrogance. "The chart review contests both failed," she said. "The documentation I filed in both cases was upheld." "Yes. And the shift assignments, the ones he's characterizing as my resistance to scheduling, were overnight rotations he assigned me after I flagged a medication error in his dosage order. You can cross-reference the dates." Harmon looked at the folder again. Foss wrote something. "We're also aware," Foss said, "that you performed your initial assessment of at least 4 patients this morning before physicians had evaluated them and made treatment decisions, including fluid rates and pain management, that technically require physician sign-off. Those decisions required sign-off that I obtained retroactively from the attending once the immediate crisis stabilized, every one of them." She paused. "In a mass casualty event, retroactive sign-off is standard practice. It's in the ACSTQI P mass casualty guidelines, which the hospital's own emergency protocols reference." A silence. Then Briggs said, "Can I speak?" It was not phrased as a question. Foss looked at him with the expression of a lawyer encountering a jurisdiction he hadn't prepared for. "Colonel Briggs," Harmon said, "you're here as a military liaison regarding the Harwick incident. The board's personnel matter is related," Briggs said. "Directly related." He reached into the document case beside his chair and put a folder on the table. He slid it toward Harmon. Lauren Hayes served in the United States Army for 7 years. She completed advanced trauma training at Fort Sam Houston, deployed 3 times to active combat environments, and was awarded the Army Commendation Medal for actions during a mass-casualty event in Kandahar Province in 2019, an event in which she sustained 11 casualties under enemy fire without a physician present and lost none of them. He let that sit for exactly 2 seconds. She also co-authored the Battlefield Triage Adaptation Protocol that the Department of Defense adopted in 2021. The protocol she used on your ER floor this morning is, in part, a document she helped write. The room was quiet. Foss's pen had stopped moving. Harmon opened the folder. She read for several seconds. Her face did not change expression, which was its own kind of expression. "This wasn't in her employment file," Harmon said. "No," Lauren said. "It wasn't."
Why?
She thought about how to answer that. There were several true answers, and some of them were too long for this room, and some of them were too personal, and one of them was simply, "Because I came here to be a nurse," not a resume. But that answer would sound like something it wasn't, like evasion, or like a statement about this hospital specifically, when it was really a statement about the person she'd been trying to be for the past 18 months, and the difficulty of being that person in a building that kept asking her to be someone else. "I applied for a nursing position," she said. "My military record wasn't relevant to the role." "It's—" Harmon stopped herself, started again. "It's quite relevant to this morning." "Yes." This morning was different. One of the federal agents, she'd mentally labeled them as such based on the suits and the silence, leaned toward Briggs and said something in a voice too quiet to catch. Briggs nodded once. "There's a secondary matter," Briggs said. He looked at Lauren. "Reeves's assessment of the Harwick blast has been corroborated by preliminary forensic findings. The first charge was deliberately placed. We have 7 individuals from the facility in this building right now, either as patients or waiting for transport, who may have material knowledge of who placed it and why." He paused. "I need someone who can conduct welfare interviews with those individuals, who understands both the medical status of each person and how to conduct a structured conversation with someone who has been through a traumatic incident. My team can provide the questions, but the person who gets access to those patients needs to be someone they already trust." Foss said, "That's outside the scope of—" "Those patients have been in this nurse's care for the last 4 hours," Briggs said. "She knows their status, they know her face, and 3 of them have specifically asked for her by name." He looked at Harmon. "I can route this through the state emergency management structure if necessary, which will take about 6 hours and will involve considerably more institutional disruption than asking your nurse to spend 90 minutes talking to people she's already been talking to." Harmon looked at the folder again, then at Lauren, then at the window. "Dr. Cole," she said finally, "submitted his complaint this morning before the casualties arrived, on the basis of documented incidents over the past 3 months. She closed the folder. "How do you want to respond to those incidents, Ms. Hayes?" "Not this morning. The prior months." Lauren had spent 3 months being systematically targeted by a man who had experienced a medication question as a personal attack, and she had documented every instance, not because she planned to use it, but because documentation was what you did when you worked in environments where you understood, intuitively, that things could go sideways. "I'd like to request that the board review the full documentation trail for each of those incidents," she said. "My responses, the chart review outcomes, the shift schedule with dates compared against the dates of my clinical flags. I'd also like to note that in 3 months, I have had 0 patient complaints, 0 adverse events attributable to my care, and 2 written commendations from patients' families that were submitted to the nursing director's office." She paused. "You can verify all of that before end of business today?" Harmon looked at Foss. Foss looked at his notepad. He had the expression of a man whose agenda had been built on a foundation that was now, quietly and efficiently, being disassembled. "We'll need time to review," Harmon said. "Of course." Lauren stood. "I need to go check on a patient." "We're not—" Foss started. "I've answered every question you've asked." She was not rude about it. "If you have more, I'm available. But I have a patient in recovery whose daughter has been waiting for an update for 2 hours, and I told that girl I would find out." No one stopped her. She walked out of the conference room into the hallway, and the door closed behind her, and she stood there for exactly 5 seconds doing nothing at all, just breathing. Then she went to the elevator. David Kowalski was in post-surgical recovery on the second floor, conscious and pale and attached to more monitoring equipment than was probably comfortable. His wife had arrived sometime in the last hour, a woman in her late 30s, with Kowalski's same dark hair and the raw, specific look of someone who had driven to a hospital very fast. She was holding his hand with both of hers. Maya was on the chair beside the bed. She looked up when Lauren came in. "He's okay," Maya said. To Lauren, not to confirm, to report, like she'd been waiting to deliver the information herself. "He is," Lauren said. She looked at Kowalski. "How are you feeling?" "Like someone used my insides as a punching bag." His voice was rough but present. His eyes tracked correctly. His color was returning. Vasquez had done good work. "They tell me you caught it." "I noticed some things. Dr. Vasquez fixed it." "They said if you hadn't flagged it." He stopped. His wife's hands tightened on his. "Thank you." She didn't have a version of "you're welcome" that felt right for this, so she just nodded and checked his chart and confirmed with the recovery nurse that his vitals were trending correctly. She made one note and initialed it. At the door, Maya said, "Lauren?" She turned. "You said some parts are better." Maya was still in the chair, feet not quite reaching the floor. "The hard ones. Are the hard ones better?" She thought about the question. About 14 hours of a morning that had been, by any objective measure, extremely hard. About a conference room on the 4th floor where a lawyer with a notepad had laid out 3 months of someone's attempt to unmake her, and the way she had sat across from it and said, "Check the documentation." "Yeah," she said. "The hard ones are usually the ones that matter." She was back on the 3rd floor at 11:40, reviewing the transition handoff with Beckford, when her phone buzzed. "Webb," Cole pulled his complaint. "Just now." Harmon's office called him in and he pulled it. She read the message twice. Then she put the phone in her pocket and went back to the handoff. She was in the break room at 12:15, the first time she had sat down in 14 hours, with a cup of coffee that was too hot and a granola bar she'd been carrying since 7 in the morning, when Briggs came through the door. He didn't sit. He stood with his hands in his jacket pockets, and she recognized the posture as the one he used when he had something to say that he hadn't decided how to frame yet. "The board is meeting this afternoon," he said. "Harmon called it. Whatever they do, it's going to move fast." "I figured. Cole's complaint being pulled doesn't close the file. The board still has to address the morning's events formally." "I know. You're not concerned." "I'm tired." She took a sip of the coffee. "There's a difference." Briggs was quiet for a moment. Outside the break room window, Ashford continued its morning, the city carrying on at whatever pace a city managed after a refinery explosion and a 14-hour mass casualty event, and the particular, invisible kind of reckoning that had been happening in a conference room and a recovery ward and a nurse's station all at the same time. "The Harwick investigation is going to surface names," Briggs said. "People at the facility who knew about the secondary operation. Some of them are still in this building." He paused. "One of them, we think, is not a facility employee." She looked at him. "We have a person of interest who accessed the plant 3 times in the last month under a contractor credential that was issued, we now believe fraudulently, through a vendor with ties to hospital administration." His voice was flat. "We don't know yet who in this building signed off on that credential. We're finding out." The break room was very quiet. "Hospital administration," she said. "Possibly. Could be clerical, could be higher." He met her eyes. "I'm telling you because you're going to be in this building for the next several hours, and I need you to continue doing exactly what you've been doing. Don't ask questions. Don't change your behavior. Just work." "Briggs," she set down the coffee, "is the person still here? In the building?" He held her gaze for 3 seconds longer than the answer required. "We think so," he said. And then his phone buzzed, and he looked at it, and something in his face changed. Not alarm, something more specific than alarm, something like the confirmation of a thing he'd been hoping was wrong. And he said, "Stay here." And he was out the door before she could answer. She sat with her coffee for exactly 4 seconds. Then she stood up and followed him. The hallway outside was normal looking in the way that hallways looked normal right up until they didn't. Staff moving, gurneys, the ambient sound of a hospital floor in mid-morning operation. Briggs was ahead of her, moving fast toward the north stairwell, and one of his team members was coming from the opposite direction, talking into a radio with the tight, clipped cadence of someone relaying information that had just changed the picture. She caught one word as the team member passed her. Reeves. She was already running. The south wall where she'd left Reeves 3 hours ago with his leg elevated and his fluids running and his particular capacity for stillness that she had trusted because she had trusted it for 11 months in much worse circumstances. The south wall was 15 seconds away at a jog, and she made it in 12, and she turned the corner and stopped. The gurney was there. Reeves was not. The IV line had been disconnected at the port, cleanly, the way someone who knew what they were doing would disconnect it. The monitoring leads were on the gurney, removed in order. His chart was on the floor, which was the only thing that looked wrong. The chart should have been on the hook, and it was on the floor. And that was either careless, or it was a sign that the person who had removed him from this gurney had been in a hurry. Briggs arrived beside her 4 seconds later. He looked at the gurney. How mobile was he? He said. She thought about the fracture, the pain response, the fluid status, the 14 stairs between the south wall and the nearest exit. Not very. Then he didn't leave. They looked at each other. He was taken, she said. Briggs already had the radio to his mouth. Briggs had 3 people on the radio within 45 seconds, and a building lockdown initiated within 90. Not a full lockdown. Not the kind that closed every exit and stopped every elevator and turned a hospital into a sealed box. Because a sealed box with 400 patients and 200 staff was its own kind of crisis. A targeted lockdown. Exit monitoring, stairwell cameras reviewed in real time, the specific kind of controlled net that military training built for environments where you needed to contain without triggering panic. Lauren stood at the empty gurney and thought about the IV line. Disconnected at the port. Clean, sequential, in order. That was medical knowledge, or training close enough to it. The monitoring leads removed without tangling, which meant someone who understood the clip mechanism. Not a panicked grab. A procedure. How long was he unmonitored, she asked. One of Briggs's team, a woman named Sato, compact and fast-moving, who had been coordinating the Harwick survivor interviews, checked a tablet. Last nurse check-in logged at 11:22. Your team had 40 other patients. Nobody flagged the gap. It was now 12:31, 69 minutes. Enough time to move someone who couldn't move himself. Enough time to get somewhere inside this building that wasn't a main corridor. Storage, Lauren said. Briggs looked at her. Sub-basement. Medical supply storage, East Wing. She was already thinking through the building the way she'd spent 3 months mapping it. Not the patient floors, not the OR suites, but the spaces that hospital staff moved through without thinking. The infrastructure level that kept everything above it running. There's a freight elevator on the north side that doesn't require a badge below level 2. Maintenance uses it for bulk deliveries. It's not on the main security map because it was added in a 2018 renovation and the system update was never fully completed. A beat. How do you know that? Sato said. I did the supply audits. She looked at Briggs. Cole assigned them to me as punitive work. I mapped every storage route in this building. Briggs made a decision in approximately 1 second. Take us. She took them. The freight elevator was behind a door marked maintenance. No patient access. Which was the kind of sign that worked on patients and was meaningless to anyone who knew the building. The elevator was old, slow, and smelled like industrial cleaner and cardboard. It fit 4 people uncomfortably. Briggs, Sato, Lauren, and a team member named Ferris, who was carrying something under his jacket that she didn't ask about. Sub-basement was cold. Hospitals ran their storage cold for pharmaceutical stability, and the East Wing sub-basement was colder than most because it also housed the backup generator systems, which vented heat upward and left this level in a permanent chill. The lights were motion-activated fluorescents that flickered on 10 seconds after you entered a corridor, which meant moving through unfamiliar sections meant walking in partial dark until the sensors caught up. Lauren knew the layout. She moved without waiting for the lights. The first storage bay was empty of people. The second had a maintenance worker who looked up from a supply manifest with the expression of someone who had been having a completely normal morning until 45 seconds ago when 4 people appeared in his corridor. Briggs showed credentials. The maintenance worker stepped aside. Third bay. Lauren stopped. The door was 6 inches open. It was always closed. She'd been down here 8 times, and it had always been closed and locked with a keypad, because this bay held controlled substance backup stock and backup pharmaceutical refrigeration units. Briggs put a hand out. She stopped. He and Ferris went first. She heard Reeves before she saw him. Not a voice, a sound. The specific kind of sharp exhale that someone made when they were managing significant pain and had been managing it alone for a while. He was on the floor against the far wall, between a refrigeration unit and a shelving rack, his splinted leg extended, his hands zip-tied to a pipe running along the wall at approximately chest height. He looked up when they came in. "Took you long enough," he said. "Who brought you here?" Briggs said. "Never saw a face." "Hood." He shifted and the pain showed. 2 people, minimum. One knew this building, moved like they'd done it before. Ferris was already on the zip ties. Lauren crossed to Reeves and did what she always did. Quick, automatic assessment. His color was poor, which was partly the cold and partly the blood pressure effects of pain on a fracture that had been jostled in transit. His IV had been out for over an hour. She looked around the bay and found, improbably, a saline bag on the pharmaceutical shelf, standard stock, still sealed, and a line kit in a drawer below it. "I'm going to restart your fluids," she said. "I know you are." He held out his arm without being asked. While she worked, he talked. "Before they hooded me, maybe 30 seconds after the first person came, I heard a name. They didn't know I was conscious. My pain response is different from most people's, comes from a long time of learning not to show it." He paused as the needle went in. The name was Harmon. The room went very quiet. Lauren kept her hands moving. IV placed, line connected, flow rate set. She did not look up. "First name or last?" Briggs said. "Last. Said it the way you say a last name when you're confirming an instruction." Harmon said the East Wing. That's all I caught before the hood went on. Briggs and Sato exchanged a look that Lauren caught from her peripheral vision. The specific look of 2 people confirming something they had been building toward and had not yet wanted to say out loud. Harmon. Diane Harmon, chief of medicine, 61 years old, who had been in the conference room on the 4th floor when Briggs had laid out Lauren's military record. Who had access to every administrative system in this building? Who could have issued a vendor credential? Who had been... Lauren was now running the timeline, positioned between Lauren and the exit every time today that something important shifted. She finished the IV setup and sat back on her heels. "She was in the conference room," Lauren said, "when you told her my record, when Foss was building the case against me." A pause. "If she's involved, she knew who you were before you walked in. She knew this morning was going to bring military presence." "And she still sat in that room," Sato said. "Because leaving would have looked wrong," Briggs said. "She stayed because she needed to know what we knew." He looked at Reeves. "Can you be moved?" "I could have been moved an hour ago." "I mean properly. Upstairs, documented, medical supervision." Reeves looked at Lauren. "His pressure's low and his fracture was stressed," she said. "He needs to be moved carefully, on a gurney, with someone monitoring his leg. He can be moved." "Then let's get him up." Briggs was on the radio again, rapid and clipped. "Requesting personnel, requesting a gurney at the freight elevator, requesting that the 4th floor conference room be held and that no one currently in it be allowed to leave." Lauren heard the last instruction clearly. No one currently in it be allowed to leave. She stood up. "She's still up there?" "Meeting ended 40 minutes ago," Sato said. "Harmon said she was going back to her office. Whether she actually did?" She was already checking her tablet. "Her badge hasn't scanned since the 4th floor exit at 12:08. What's between the 4th floor and the outside of this building that doesn't require a badge scan?" Sato's jaw tightened. "The south stairwell, emergency exit at ground level. It's alarmed, but the alarm logs to security desk, not to the main monitoring system," Lauren said, because it was installed in the same 2018 renovation. She didn't wait for Briggs to tell her to stay. She took the freight elevator up alone while Briggs coordinated Reeves's transport, because Briggs was a colonel managing a federal investigation and a military asset extraction, and Lauren was a floor nurse who knew this building better than anyone in it, And the south stairwell ground exit was 3 minutes from where she was standing and 30 seconds from the ambulance bay where, she was now calculating, a vehicle could be waiting without attracting significant attention because vehicles in hospital ambulance bays were background noise. The freight elevator was slow. She used the time to think about Harmon. 61 years old, chief of medicine for 9 years. The kind of institutional authority that became invisible because it had been present for so long. The kind of person who could sign a vendor credential and have it filed and forgotten. Who could access patient records, movement logs, staff assignments. Who had sat in a conference room this morning and listened to Briggs explain Lauren's background with an expression Lauren had read as professional neutrality and now reread as something else. The careful, calibrated stillness of someone performing a reaction they'd had to construct. The elevator opened at ground level. She went left, away from the main ER, toward the south corridor that the hospital used for supply deliveries and staff parking access. The fluorescents here were steady and full. Ground level had proper lighting. She moved fast and quiet, which was a combination she'd learned in places where the two things were prerequisites for being where you needed to be. The south stairwell door was propped open with a rubber wedge. Not how it was supposed to be. The wedge was the kind maintenance used, gray rubber, exactly the kind of thing someone who knew the building would know where to find. She pushed through the door into the ambulance bay. The bay was busy in the way it had been all morning, reduced from the surge peak, but still 2 ambulances present, personnel moving, the standard controlled activity of a hospital external zone. She scanned left to right the way she'd been trained, not looking for a person, but looking for wrongness, for the thing that didn't fit the pattern of the space. She found it. A dark blue sedan, parked at the far end of the bay, in a space designated for medical transport vehicles, engine running. Not an ambulance, not a hospital vehicle. The driver's side was away from her, but the exhaust was visible, a thin thread of it in the cold October air. And walking toward it, fast, with a bag over one shoulder and her blazer replaced by a dark coat that she hadn't been wearing in the conference room, was Diane Harmon. Lauren moved. She was not running. Running attracted attention, stopped people, changed the quality of the space in ways that would make Harmon look up too soon. She walked fast and direct, angling to intercept at the sedan's passenger side before Harmon reached the driver's door, and she covered the distance in the specific way she had covered distances in other places, where the gap between where you were and where you needed to be was not a metaphor but a number you ran in your head. She got there first. She put her hand on the passenger door. Harmon stopped. 4 feet between them. The sedan's engine running. 2 ambulances 20 meters away with their backs turned, personnel occupied. The sky above Ashford gray and cold. The smoke from Harwick still visible as a dark line on the eastern horizon. Harmon looked at her. Something moved across her face. Not guilt, not fear. Something more complicated. The expression of a person who had built something over a long time and had just watched the structure fail in a specific place they'd thought was solid. "Ms. Hayes," she said. "Dr. Harmon." A pause. Harmon's hand was on her bag strap, not reaching for anything, just holding it, the physical equivalent of a person anchoring themselves to the one thing they still had control over. "You should go back inside," Harmon said. "You've been on shift for 14 hours. "I know." Lauren didn't move her hand from the door. "Reeves is upstairs. He told Colonel Briggs what he heard before they hooded him." Harmon's jaw tightened by a millimeter. "The vendor credential," Lauren said. "The one that gave the saboteur access to Harwick 3 times in the last month. Briggs's team is pulling the authorization chain right now." She paused. "How long?" "I don't know what you... How long were you involved with whatever was running out of that facility?" The question sat between them in the cold air. Harmon looked at Lauren with an expression that was recalculating something, estimating something, and Lauren recognized the calculation because she'd seen it before in interrogation rooms and in the field, and in the specific moment when a person was deciding whether the story they'd been telling was still survivable. "You're a nurse," Harmon said, not dismissive this time. Something else, almost wondering. "You've been here 3 months. 11 weeks when I corrected Cole's dosage order. 3 months now. And you..." She stopped. "Cole filed that complaint against you this morning because I told him to." The admission landed quietly, without drama. Lauren had been close to this conclusion since the conference room, but close and certain were different things, and certain had a different weight. Why? Lauren said. Because you were paying attention. Harmon's voice was flat now, the professional cadence gone. You've been paying attention since you got here, the kind of attention that… She stopped again. People like Cole are useful. They have enough ego to make their conflicts about themselves. I knew if I pointed him at you, he'd build a file, and that file would be the first thing anyone looked at if you tried to raise questions about hospital operations. I wasn't raising questions about hospital operations. Not yet. Something in Harmon's face shifted. But you would have. People like you always do. She said it without apparent bitterness, like a statement of fact. You see things. Lauren held her gaze and said nothing. Behind Harmon, at the far end of the ambulance bay, she could see the south stairwell door opening, Briggs and Sato, and two other personnel moving with the specific, purposeful calm of people who had located their target. Harmon heard the door. She turned and saw them and turned back. I made a mistake, Harmon said, very quietly. Not the one you think. The mistake was… She paused. I thought I could manage it, keep it contained. The arrangement at Harwick was supposed to be clean. Nobody was supposed to get hurt. 11 people are dead. Harmon closed her eyes for 1 second. I know. Reeves could have died this morning. I know. And you sat in a conference room this morning and listened to a lawyer try to end my career while this was happening. Harmon opened her eyes. She looked at Lauren with the expression of a person who had spent a long time being the most important person in a room and had just arrived at a room where that wasn't true anymore. Yes, she said. I did. Briggs was 15 meters away. Harmon looked at him. Then she looked at the sedan's running engine. Then she looked at Lauren's hand on the door. Will you… She stopped, started again. Does it matter that I'm sorry? Lauren thought about 14 hours. About Gerald Marsh and the dosage order that started all of this. About Torres on a table bleeding internally while Cole found his footing. About Reeves on a cold sub-basement floor with his hands zip-tied to a pipe. About Maya in a chair with her feet not quite reaching the floor, quoting her teacher. It matters, Lauren said. It doesn't change anything. She moved her hand from the door. Briggs and Sato reached them 30 seconds later. Lauren stepped back. She did not watch the specifics of what followed. The formal identification, the rights advisement, the particular procedural language of a federal apprehension. She had been in enough operational environments to know that there was a point where her role ended and someone else's began, and this was that point. She walked to the stairwell door, stepped inside, and let it close behind her. The stairwell was quiet. She stood on the bottom step and looked up at the flights above her and felt, for the first time since 7:03 that morning, the full weight of her own exhaustion. Not the managed, suppressed version she'd been running on. The actual version. The one that lived in her feet and her lower back and behind her eyes, and had been waiting patiently for a moment when she couldn't ignore it anymore. She had 14 flights to walk. She took them one at a time. The fourth floor was a different environment than it had been 2 hours ago. The conference room now held 4 federal agents, 2 military personnel, a hospital attorney who had replaced Foss, and who had the look of someone who had been briefed rapidly and was still integrating information, and Dr. Adrian Cole, who had been asked to wait and had been waiting for 40 minutes without being told why. Lauren found this out from Webb, who found her in the third-floor corridor at 1:45 looking, by his account, like someone who had been through a mass-casualty event and a federal operation on the same morning. Cole's upstairs, Webb said. Nobody's told him anything. He's been up there since… I know. She leaned against the wall for a moment. Just a moment. How's the floor? Beckford has it. It's manageable, down to 22 active patients. 7 discharged, 4 transferred to regional facilities. He paused. Vasquez said Torres is going to be fine. Should be extubated tomorrow. Good. Lauren. He stopped. Harmon. You heard. It's going through the building. He looked at her with the expression of someone who was remapping a space they thought they knew. She ran this hospital for 9 years. I interned here. He stopped again. Did you know? Not until this morning. But you suspected something. I suspected Cole had help. A pause. I didn't know the shape of it. She pushed off the wall. Her body protested, quietly and specifically. I need to go upstairs. They'll debrief you again. I know. And then? She thought about that. About what came after a day like this one, which was a question she had some experience with and no reliable answer to. Then I'm going to eat something and sleep for approximately 1 year, she said. And then I'm going to come back tomorrow and do my job. Webb looked at her. Just like that. What else would I do? She left him in the corridor and took the elevator to 4. The conference room had been reorganized. The hospital attorney, a man named Gould who introduced himself with the rapid efficiency of someone on a clock, told her in the hallway that the board had convened an emergency session at 1 o'clock, that Harmon's apprehension had been communicated to the board chair within minutes of it occurring, that the board was currently in possession of Briggs's documentation, the federal preliminary findings on the Harwick investigation, the full trail of the vendor credential authorization, and Harmon's own administrative access logs, which showed a pattern of database queries going back 4 months that the board's IT security team was now characterizing as systematic. We also, Gould said, have pulled every personnel action that Dr. Harmon had direct or indirect involvement in over the past 18 months, including the processing of complaints against nursing staff. He said this very specifically. The complaint Dr. Cole submitted this morning was processed through a channel that Harmon controlled, Gould continued. She didn't fabricate the complaint. Cole wrote it himself. That's his conduct to answer for. But she expedited its handling in ways that were irregular. Ways that we believe were designed to create a formal record against you in advance of any investigation. Lauren absorbed this. What happens to the complaint? It's been formally withdrawn from consideration. The board will be issuing a statement. Gould paused. Ms. Hayes, I want to be transparent with you. The board is going to move quickly on several fronts today, and your position is, he chose his words carefully, your position is central to several of those fronts in ways that are going to require your input. I understand. Are you represented, legally? No? You may want to be. Given the scope, Mr. Gould, she looked at him. I've been awake for over 20 hours. I spent 14 of them running your ER through a mass casualty event. I have answers to every question the board has. I have documentation for everything I've done, and I have nothing to hide. A pause. Can we just go in? He blinked. Then he opened the conference room door. Cole was at the far end of the table, which was now populated differently than it had been that morning. The federal agents at one end, 2 board members she recognized from the all-staff meeting portrait wall, Briggs and Sato, and an empty chair next to Gould that was presumably for her. Cole looked up when she came in. His face did the thing she'd seen beginning in the ER that morning after Briggs had arrived, after Reeves had said her name, the specific dismantling of a certainty that had been so complete it hadn't needed questioning. He looked like a man who had built his entire understanding of a situation on a foundation he hadn't examined, because foundations didn't need to be examined when they'd always been solid. She sat down. The board member on the left, a woman in her 60s named Prescott, chair of the quality committee, whose name Lauren knew from a compliance bulletin, opened a folder and did not preamble. Dr. Cole, Ms. Hayes, we're going to address several matters this afternoon in sequence. The first is the formal complaint submitted this morning against Ms. Hayes. The second is the pattern of conduct documented in the incidents Dr. Cole cited. And the third is the conduct record for Dr. Cole himself, including but not limited to today's events, and a broader review that this board is initiating effective immediately. Cole said, I'm sorry. A review of my conduct. Yes. Prescott did not look up from her folder. It has come to the board's attention that several of the incidents cited in your complaint against Ms. Hayes involve actions she took to correct or flag clinical decisions you made. The board wants to understand those incidents in full, including the original dosage order that initiated the conflict. Cole's expression went through several things in quick succession. The dosage order was within clinical parameters. The chart review found otherwise, both times. Prescott looked up. Dr. Cole, you have been at this institution for 14 years. Your surgical record is significant, and the board values that. But we are also looking at a pattern of using institutional mechanisms to suppress clinical feedback, and that is a different matter. The room was quiet. Cole looked at Lauren. She looked back at him without expression. She was too tired for expression. "The patient this morning," he said. "Not to the room. To her." "Torres, I made the right call." "You did," she said. "After you—" He stopped. "After the situation was already restructured." "Yes." He held her gaze for a long moment. I froze. For 30 seconds. "That's long enough." "Yes," she said. "It is." It wasn't an attack, it was just true, and they both knew it was true, and the truth of it sat between them without requiring anything else. Prescott moved on. She walked through the documentation, methodically, without drama, in the way that institutional accountability worked when it actually worked, which was slower and less satisfying than most people imagined and more thorough than most people expected. The dosage order and Lauren's flag, the 2 chart reviews and their outcomes, the shift scheduling pattern, cross-referenced with the dates of Lauren's clinical interventions, the complaint processing channel and Harmon's fingerprints on its expediting. Then she turned to the morning, the mass-casualty response, the triage board, the needle decompression, the authorization chain for Lauren's clinical decisions, each of which had been retroactively signed off by attending physicians, and which had, in every case, been the correct decision. Then she put the folder down. "Ms. Hayes, the board wants to formally acknowledge that your actions during this morning's emergency response were not only appropriate but decisive. The modified mass-cal protocol you implemented is estimated by our emergency medicine consultants to have significantly improved outcomes for between 8 and 12 patients who might otherwise have deteriorated in the surge." She paused. "We are also aware that this is a fraction of what you brought to this situation, and that the institution failed to make use of your full qualifications in ways that we will be addressing." Lauren said nothing. "We would like to discuss your role here going forward," Prescott said. "Your current position and your compensation and your scope of practice in light of—" "I appreciate that," Lauren said. "Can we do it next week?" Prescott stopped. "I'm not being dismissive. I want to have that conversation." She looked at the board members, at Briggs, at the federal agents who were still processing their own separate investigation at the far end of the table. "But I've been awake for 22 hours and I want to go home." A pause that lasted exactly 2 seconds. Then Prescott said, "Of course, we'll schedule for Monday." She stood up. Cole stood up at the same time, which was not something she'd expected, and for a moment they were both standing and the table was between them and the room was full of people watching. Cole said, "I need to say something." She waited. "What I did, the shifts, the complaints, the way I treated you from the first week." He was looking at the table, not at her, not performing, just finding words in a place where he apparently hadn't kept many. "That wasn't clinical, that wasn't professional judgment. That was—" He exhaled. "I was wrong." The room was very quiet. "I know," Lauren said. "I'm saying it formally, in front of—" He gestured. "I heard you." He looked up then. "Does it matter that I'm saying it?" She thought about what she'd said to Harmon in the ambulance bay, 4 hours and a lifetime ago. "It matters. It doesn't change anything." "It matters to your patients," she said, "if it changes how you treat the next nurse who flags something you got wrong." A pause. "That's what it matters to." She picked up her jacket from the back of the chair. She walked out of this conference room and the door closed behind her, and the hallway of the 4th floor was empty and fluorescent and absolutely ordinary. She took the elevator down. She clocked out at the nursing station. She said goodnight to Beckford, who looked at her with something that was not quite awe and not quite relief but lived somewhere between the two. She walked out the main entrance into the cold October afternoon. The smoke on the eastern horizon was thinner now. The hospital parking lot had the particular quiet of a space that had been chaos 8 hours ago and was now just a parking lot again. Somewhere inside the building, Reeves was in a proper room with his leg properly managed. Torres was breathing. David Kowalski was going to go home to his daughter. She sat in her car and did not immediately start the engine. She sat there for 4 minutes, not thinking about anything in particular. Just sitting, just being a person in a car in a parking lot in Ashford, Ohio, who had done what the day required and was now, for the first time in 22 hours, not required to do anything. Then she started the car. Her phone buzzed as she pulled out of the lot. A number she didn't recognize, with a Fort Sam Houston area code. She let it go to voicemail. She was 3 blocks from the hospital, at a red light, when her phone buzzed again. Same number. Then a text. Hayes. It's Briggs. Call me when you're somewhere you can talk. Not about Harwick, about something else. Don't ignore this one. She stared at the text for the length of the red light. Then the light went green. She drove. Whatever it was, it could wait until she'd slept. Whatever Briggs needed, whatever something else meant, whatever was still coming, and she could feel, with the particular instinct of someone who had learned that the end of one situation was rarely the end of anything, that something was still coming. It could wait until morning. She was 4 blocks from her apartment when the second text arrived. We found a second credential, issued the same day as the first. Different name, still active. Whoever used it is still in Ashford. She pulled over. Read it again. Looked up at the street around her. Ordinary afternoon, October light. People walking. A city going about its business 12 miles from an explosion that had killed 11 people and exposed something that, apparently, was not finished exposing itself. She sat very still. Then she picked up her phone and called Briggs back. Briggs picked up on the first ring. Tell me about the credential, she said. We pulled the full authorization log 20 minutes ago. Harmon issued 2 vendor credentials on the same date, October 3rd, different names, same access tier, same facility clearance for Harwick. His voice was flat and moving fast the way it moved when he was working. The first one belongs to the individual we've already identified as the primary operative. The second was issued to a name that doesn't match any known employee, contractor, or vendor in the Harwick system. A ghost credential. Yes. Whoever used it was careful, accessed the facility twice, both times during shift changes, both times during periods of high personnel movement. They knew the facility's rhythms. Someone who'd been inside before. Or someone who'd been fed detailed information about the inside. A pause. The credential was used as recently as October 19th. 4 days before the blast. She was still pulled over. The engine running, the heater doing something insufficient about the October cold, the street outside her windshield going about its ordinary business. She watched a man walk a dog past a mailbox and thought about October 19th and what had been happening at Crestwood on October 19th, which was a Thursday, which was the day she had caught the sepsis case that Cole had later contested in chart review. Briggs, she said, the credential was issued through hospital administration. Yes. Harmon would have had help. Someone who understood the vendor system well enough to process a credential without triggering the standard review flags. Someone inside the administrative structure. We're looking at that. You said the person is still in Ashford. The credential was pinged this morning, 6:47 a.m. He let that settle. Before the first blast. 6:47. She ran it. The Harwick explosion had been reported to emergency services at 6:52, which meant the second credential had been used at the facility 5 minutes before the blast that destroyed it, which was not a coincidence in any universe. They were there, she said, at the facility this morning, and then they left. Before the emergency response activated. Before any perimeter was established. A pause. We think they're in Ashford because their vehicle was captured on a traffic camera at the Route 9 junction at 7:14 heading toward the city. We lost them after that. What kind of vehicle? Gray Accord, 2019. Partial plate, still working on the rest. She looked at the street. Ordinary afternoon. What do you need from me? Right now? Nothing. Go home. Sleep. We have people working it. A pause that was longer than his usual pauses. Lauren. He didn't use her first name often. She noticed it when he did. You did good work today, he said. The triage, the response, all of it. You know I don't say things I don't mean. I know. Go home. She sat with the phone for a moment after he hung up. Then she pulled back into traffic and drove the 4 blocks to her apartment and went inside and set her alarm for 6 hours from now and lay down on her bed, still in her scrubs, and was asleep before she'd finished deciding to be. She slept 5 hours and 40 minutes. When she woke up, there were 11 texts and 3 voicemails, and the light through her window was the particular gray of early evening, and she lay still for 30 seconds doing an inventory of her body, the way she'd learned to do in places where knowing exactly how functional you were was the difference between good decisions and bad ones. Her feet still hurt. Her lower back was specific and insistent about its objections. Her left shoulder, which had an old injury that announced itself in cold weather, was announcing itself. She got up and made coffee and read the messages in order. Webb, twice. The floor was stable. He'd gone home at 4 and Beckford had handed off to the night team without incident. Torres had been extubated ahead of schedule and had asked about the nurse who'd flagged his deterioration. Vasquez had told him her name. Gould, the board attorney. Monday's meeting had been moved to 9 a.m. He would send an agenda. Reeves. A text, not a call, which was characteristic of him. Leg is fine. Hospital food is not. Bring something real when you come back. Briggs. One call, no voicemail. She called him back. We have him, Briggs said. She put down her coffee. Gray Accord was registered to a shell company. Took us 4 hours to unravel. The shell company was connected to a property management firm that leased office space on Millard Street in Ashford. We went there 2 hours ago. A pause. The individual is in federal custody. I'm not going to say more than that on an open line. Connection to Harmon? Direct. He processed the vendor credentials on her system using her administrative access, BASE. She gave him her login. Whether that was coerced or consensual is something the federal attorneys will be working out. Another pause. What I can tell you is that the Harwick operation is fully exposed. We have the documentation from Reeves, physical evidence from the facility that survived the blast in a structure we didn't expect to survive, and now a second individual in custody who is, as of 90 minutes ago, cooperating. She thought about Harmon in the ambulance bay. The arrangement was supposed to be clean. Nobody was supposed to get hurt. That was the thing about arrangements like that. They were always supposed to be clean. Is it over? She said. The Harwick piece is over. A pause. The rest of it, the legal process, the institutional review, that's going to take time. But the operational piece is done. She exhaled. Lauren, Briggs said. Monday meeting with the board. 9 a.m. I'm sending a letter from my command, documenting your qualifications, your service record, and a formal recommendation. He said it the way he said things that weren't negotiable. You can choose what to do with it. Briggs, you spent 3 months letting someone use your silence against you. I'm not going to let that continue when I have the ability to do something about it. A pause. That's not charity. That's correcting a record that should have been correct from the start. She thought about the employment application she'd filed in July, the box she'd left blank where it asked about prior specialized training, the deliberate choice she'd made to come here as a nurse and nothing more. She'd had reasons. Most of them still made sense to her. But reasons, she'd learned, were not the same as wisdom. Sometimes you mistook one for the other. Okay, she said. Okay. She could hear him almost smile. He wasn't good at smiling, but he was capable of almost. Get some sleep. I slept. More sleep. She hung up and finished her coffee and looked out the window at the Ashford evening, at the ordinary darkness of a city settling into night, at the amber streetlights coming on in sequence down the street. Somewhere to the east, the Harwick facility was a ruin with a federal perimeter around it, and somewhere in this city, 2 people were in federal custody, and somewhere in Crestwood Medical Center, a man named Torres was breathing without a machine, and a man named David Kowalski was going to go home to his daughter within the week, and a woman who'd had a tension pneumo at 7:15 in the morning was sleeping in a hospital room with oxygen saturation at 96. She made herself something to eat. She went to bed. She slept 9 more hours, which was more than she could remember sleeping in a single stretch in a very long time. Monday came. She wore the same things she'd worn to every staff meeting at Crestwood. Dark slacks, sensible shoes, her ID badge on the lanyard she'd been issued in week 1. She did not dress differently for the board. She had learned, in environments considerably more consequential than a hospital boardroom, that the way you dressed for a meeting communicated either that you needed the meeting or that the meeting needed you, and she'd made her decision about which one this was. Gould met her in the lobby and walked her up, which she hadn't asked for and which told her something about how the board had been briefed over the weekend. The boardroom was on the 5th floor, a room she'd never been in. 8 people at a long table. The full board, she gathered, not just the quality committee. Prescott was in the center. At the far end, present as a formal observer with a stack of documents she recognized as the federal preliminary findings, was an agent from the agency she'd privately categorized as federal but not military. Briggs wasn't there. His letter was. Prescott had it in front of her when Lauren sat down. "Thank you for coming," Prescott said, which was the kind of thing people said in rooms like this when what they meant was something else. "Of course," Lauren said. "We've had a significant amount of information to process since Thursday." Prescott looked at her board members, then back. "I want to be direct. The board has conducted an emergency review of the events of October 23rd, the personnel actions taken against you over the preceding 3 months, and the role of the former chief of medicine in those actions." She paused. "I'm going to be direct about the conclusions." Lauren waited. "Every personnel action taken against you at the direction of Diane Harmon has been formally reversed and expunged from your record. The complaint Dr. Cole submitted has been fully withdrawn and will not appear in any future review of your employment history." Prescott's voice was steady, practiced. She'd been doing this a long time. "The board is also issuing a formal letter of commendation for your actions during the October 23rd mass casualty response, which will be placed in your permanent file." "Thank you." "There's more." Prescott glanced at the letter from Briggs. "In light of your qualifications, your demonstrated capabilities, and the significant gap between your current role and what this institution now understands you to be capable of, the board would like to offer you a revised position, Trauma Response Coordinator. It's a role we're creating, in part because Thursday demonstrated that we don't have a structured position for someone with your particular skill set." She paused. "The scope would include civilian mass-cal protocol development, staff training, and direct participation in high-acuity trauma cases. Compensation adjusted accordingly." The room was quiet. Lauren looked at Prescott, then at the board members, some of whom she recognized and some of whom she didn't. Then at the letter from Briggs, which she couldn't read from this angle but knew by heart because he'd sent her a copy Sunday morning with a note that said only, "In case they try to lowball you." "Can I ask a question?" Lauren said. "Of course." "Dr. Cole, what happens to him?" Prescott was quiet for a moment. "Dr. Cole is on administrative leave pending a full conduct review. The review will examine the pattern of behavior documented against nursing staff, the use of institutional mechanisms for retaliatory action, and several clinical decisions over the past 2 years that had previously been flagged internally and not adequately addressed." A pause. "The board has not made a final determination, but I want to be transparent. The review is serious and the documentation is significant." Lauren nodded. "Do you have concerns about working here if he returns in some capacity?" She thought about that honestly. About Cole in the ER on Thursday, about the 30 seconds he'd frozen and the decision he'd made afterward, about the conversation in the conference room and the way he'd stood up and said what he said without an audience requiring him to. "I have concerns about the behavior," she said, "not about the person, if the behavior changes. That's all I can say." Prescott wrote something. Fair. And Harmon? She was formally charged on Friday. Federal charges related to the Harwick operation, and state charges related to the vendor credential fraud. The board accepted her resignation, effective the moment she was apprehended. A pause. "She will not be returning to this institution, or we anticipate, to hospital administration." There it was. Clean and specific, the way consequences were supposed to be and so rarely were. Charges filed, position terminated, a career built over 9 years on competence and betrayal, now ending in a federal case with her name on it. There was nothing satisfying about it exactly. Nothing that felt like winning, because 11 people were still dead, and Reeves had spent an hour zip-tied to a pipe in a cold room in the Harwick facility was rubble. But it was right. The specific procedural rightness of consequences attaching to actions. That was the closest thing to justice that real situations produced. "The position," Lauren said, "Trauma Response Coordinator." "Yes, I'd like to accept." Prescott allowed herself a small, genuine expression. "Good." 2 weeks later, on a Wednesday morning with the November light thin and flat through the third-floor windows, Lauren ran her first mass-cal training exercise with the nursing staff. It was not elegant. The staff were uncertain, and several of the protocols were unfamiliar. And one nurse, a second-year named Okonkwo, who was fast and sharp and needed, Lauren had already assessed, to be given more to do, kept jumping ahead of the sequence in a way that was well-intentioned and procedurally incorrect. Lauren corrected her without stopping the exercise, the way she'd been corrected in her own training, the way things got fixed in real time instead of after the fact. Webb was there. He'd asked to attend even though it wasn't required for residents. He stood near the back and paid attention in the way he paid attention to things that he understood mattered, which was one of the better things about him. After the exercise, when the staff were dispersing and Lauren was updating her protocol board, he came over. "How do you think it went?" he said. "Rough, but the right kind of rough." She capped the marker. "They'll get it. Okonkwo is good. She's very good. She needs to learn to trust the sequence before she improvises on it." A pause. "Same thing I had to learn." He was quiet for a moment. "Lauren, can I ask you something?" She looked at him. "When Harmon set Cole on you, when all of that was happening, did you know you were going to be okay? Like, did you trust that it would work out?" She thought about the question the way she thought about questions that deserved actual consideration rather than the automatic answer. Did she trust that it would work out? She thought about documentation and shift audits and inventory routes and the specific quality of attention that she'd brought to 11 weeks, then 3 months, of being someone's target. "No," she said, "I didn't know it would work out. I knew what I'd done and what I hadn't done, and I kept the records to prove it. And I kept doing the work because the work was real regardless of what they were doing with the paperwork." She paused. "That's different from trusting that it works out. Sometimes it doesn't. But this time it did. This time it did. Because of Thursday. Because of the explosion." She shook her head. "Thursday accelerated it. But the documentation existed before Thursday. The chart reviews existed. The commendations from patients' families existed. It would have surfaced eventually." She looked at the protocol board. "Things that are true have a tendency to surface. It just doesn't always happen on a schedule that feels fair." Webb was quiet, absorbing that. She picked up her jacket. "Go do your rounds. You've got the post-op on bed 12 who needs someone to actually talk to her, not just check her chart." He went. She stood alone in the training room for a moment, looking at the board she'd built. Cleaner than the one she'd set up in the ER on Thursday. Better organized, with the procedures laid out in the sequence that she and Briggs's team had refined over the past 2 weeks into something that Crestwood could actually sustain. A civilian version of a document she'd helped write years ago in a very different context. She thought about what it meant to carry knowledge, the specific weight of it, the way it followed you from one life into another and waited, patient and inert, until the moment it was needed. She had spent 3 months trying to be smaller than she was, and it hadn't worked. Not because she'd failed at being small, but because the knowledge didn't get small with you. It stayed the same size. It stayed exactly as large as what you'd done with it. She had not come to Crestwood to be a hero. She'd come because she was 31 years old and had seen enough of what human beings could do to each other in conditions of extreme duress. And she had wanted for a while to be somewhere that was about fixing rather than fighting. She still wanted that. What she'd learned in 3 months, and especially in one very long Thursday, was that fixing and fighting were not always as separate as she'd hoped. Sometimes the work required both. She turned off the training room light and walked out into the corridor. Reeves was in the lobby when she came off the elevator. He was on crutches. Good ones, the kind that fit properly, which she'd been insistent about when the orthopedist tried to discharge him with the cheaper model. And he looked considerably better than he had on a gurney in the sub-basement with his hands tied to a pipe. He was wearing civilian clothes and the expression of a man who had recently been through something unpleasant and had decided to be at peace with it rather than dramatic about it. "You didn't tell me you were being discharged today," she said. "Didn't ask your permission. I would have fussed over the discharge paperwork and interrogated the orthopedist. I know. That's why I didn't tell you." He was almost smiling. "I wanted to walk out like a normal person." "You're on crutches." "I'm walking out like a normal person who is temporarily on crutches." He shifted his weight, and something in his face acknowledged the discomfort and then moved past it. "Briggs told me about the new position. He talks too much. He talks exactly the right amount. That's one of his skills. Reeves looked at her. Trauma response coordinator. Yes. You're going to build protocols, train civilian staff, apply 14 years of 7 years of experience to a civilian hospital in Ohio. He said it without irony, without diminishment. You know what I think? You're going to tell me anyway. I think this is exactly what you should have been doing from the start. He held her gaze. Not because the Army was wrong, but because you spent 7 years learning how to keep people alive in the worst possible conditions, and this is where all of that goes. This is what it was for. She looked at him for a moment. This was the most words Reeves had ever said to her in a non-operational context, which was notable. Are you okay? She said. I'm on crutches, and my left leg is going to ache for 6 months. Otherwise, yes. A pause. Briggs has a debrief in Fort Sam in 3 weeks. He wants you there. As a witness? As a consultant. The triage protocol adaptation you ran on Thursday. They want to formalize it. Add it to the civilian interface training package. He adjusted the crutches. You'd be developing training materials used by hospitals in every state that has a military-civilian emergency coordination agreement, which is 43 states. She was quiet. That's a lot of hospitals, she said. That's a lot of hospitals. Outside the lobby windows, Ashford was its November self. Cold, gray, moving. The smoke line on the eastern horizon had been gone for a week. The Harwick site was fenced and flagged, and would be, she'd heard, a federal site for at least another year while the investigation completed itself. The city had had its crisis and was doing what cities did, absorbing it, not quite returning to normal, reaching for some new version of normal that accounted for what had happened. How'd you get here? She said. If you didn't want me to drive you. Cab. There are no cabs in Ashford. There is one cab. His name is Lou, and he has very strong opinions about the highway system. Reeves almost smiled again. I had a 40-minute education. She pushed the lobby door open for him, and they walked out into the cold, and she stood on the hospital steps while he made his way to the parking area where, presumably, Lou was waiting. He moved carefully, but without self-consciousness, the way people who'd been injured many times moved, not pretending it didn't hurt, not performing toughness, just getting from here to there with what they had. At the bottom of the steps, he stopped and looked back. Lauren. Yeah. You spent 3 months trying to be invisible. He said it without judgment. How'd that work out? She looked at him, at the hospital behind her, at the November sky above Ashford, flat and gray and completely ordinary, which was all it was and all it needed to be. Terribly, she said. He nodded, satisfied. Then he turned and made his way across the parking lot, and she stood on the steps a moment longer before going back inside. She had a training session at 1, a protocol review at 3, and a meeting with the ER charge team at 4:30 to begin mapping the new surge response structure. She had a call with Briggs on Thursday about the Fort Sam debrief. She had a floor to learn better than she already knew it, and a staff to train, and a position that had been built for her out of the gap between what the institution had thought she was and what she actually was. She had, she realized, standing at the entrance of Crestwood Medical Center on a gray Wednesday in November, exactly the life she'd come here looking for. Not the quiet one. She'd wanted quiet and gotten something else, which was the way life tended to respond to what you wanted. But this, the work, the purpose, the particular and specific act of taking everything she carried and putting it in service of people who needed it, this was what she'd been looking for underneath the quiet. The quiet had been a means to something. She'd found the something. She went back inside. The elevator was slow, as always. She rode it up to 3, walked past the nurse's station where Okonkwo was charting with the focused energy of someone who was learning to slow down and trust the process. Past the room where a patient she didn't know yet would need something from her before the day was over. Past the window at the end of the corridor where the city was visible in its November ordinariness. She had not been given an easy 3 months. She had not been given an easy Thursday. The recognition she'd received had not come because the world decided to be fair. It had come because she'd kept the documentation, done the work, and survived long enough for the truth to catch up. That was the thing about being underestimated. It was miserable while it was happening, and it told you nothing true about yourself, and it could not, in the end, change what you actually were. The people who underestimated you were working with the story they'd decided to believe. The truth was a separate thing. It existed regardless of who chose to look at it. Cole had learned that. Harmon had learned it a harder way. The board had learned it in a conference room on a Thursday afternoon when the triage board and the military letter and 14 hours of documented decisions made the story undeniable. Lauren Hayes had known it all along, not with confidence. She'd had bad days, uncertain days. Days in the break room at 2 in the morning, wondering if the choice she'd made to come here had been the right one. But underneath all of that, through all of it, she had known what she knew and done what she could do. And she had waited, with the patience of someone who had learned patience in conditions that didn't permit anything less, for the work to speak. The work had spoken. She reached the nurse's station and picked up her first chart of the afternoon. The patient in room 7 needed to be seen. That was the next thing. That was always the next thing, and it was enough, and she was good at it, and she went.